Patty Effingham, our financing lady, and a board member, Alice Dinsdale. Somehow, they're being delayed a little bit. We've passed out minutes to the board members for approval. I think maybe if there's anybody interested in what goes on in our minutes, we can make some copies available. Has anybody or everybody read the minutes?
I have thought. What thoughts?
Oh, she told me that's I see in the back where it says a clinic in Alturas, California has the same name as we do. It's not the same name, they have the same scenario that we do, where the name, the North Lake Health Clinic, was used by the provider and would not be available for a new provider for a period of time until after Dr. Carlson is done with the name.
Yeah, we're registered with the state.
Yes. So that would be a correction in the minutes, and if so, do I hear a motion to approve the minutes with the correction?
I make a motion to move with the correction.
I'll second.
It's been moved and seconded to approve the minutes with the name change. All in favor?
Aye.
Aye. Okay, Doc, we talked a couple times lately, and you let us know that you was going to be here on our meeting date. So we agreed to have the meeting a little early to accommodate you.
Thank you.
And with that, I'm sure that the board and maybe interested people have got maybe some questions that they want to ask of you, and some of them may be a repeat, but I think they're all short.
Okay.
One is that do we have to have a doctor involved to maintain the EOCC Level 3 certification?
No.
You can do that with a nurse practitioner?
Mm-hmm.
Okay.
Yes.
Carl, I have a question at that point.
Sure.
On that piece too, as I understand that there's a new certification that nurse practitioners now can take where they can actually supervise a PA?
No.
They can't?
They cannot.
Okay, I thought I saw there was something coming up with that. Okay.
Two different boards.
Okay.
Okay, then other than the oversight of a PA provided in there, is there any other reason to have an MD involved, like for referrals or in-home care, or even billing somebody that maybe someone with lesser certification wouldn't be allowed to?
Well, at the current time, Medicare does not allow a nurse practitioner or a PA to order home health, hospice, or durable medical equipment.
Or
Durable medical equipment. So
the medical equipment?
the equipment, like if somebody needs a wheelchair, Medicare doesn't allow that.
The normal situation would be if someone came to the clinic and they were referred on to another provider of medical services, then those that medical equipment or those things could be ordered. It would be, I guess, through that provider.
If they would choose to do it, yes.
If they would choose to do it.
Yes.
Okay. Has anybody got any questions? You
I
Chuck?
just wish you'd just run through that list one more time. Oh, the equipment, hospice, was it in-home health care and something else?
Medical equipment.
Durable medical equipment, which includes things like, could even be a pair of crutches, could be a shower chair, could be a cane, could be a manual wheelchair or electric wheelchair. But that's all falls into that one category, durable equipment. And then, as I mentioned, hospice and home health.
Okay.
But
And there may be some others, yes, Dennis?
Carl? Yeah, could you mention about the certified rural health clinic? Is that?
We're not there yet.
Okay, all right.
But I have a question on the certified, on the medical, durable medical. It's also, can the provider refer them on, like can Pat refer them on to an actual MD?
Sure.
You know, just
Sure.
like a regular referral
Yeah.
that we do.
Yeah. And then that's the party that would order or support the in-home care, the medical equipment, or that stuff.
Well, and the hospice and home health also have their own doctor, MD doctor, that they fall back on to have any orders if Dr. Carlson isn't available.
Yeah, we're just trying to establish the chain of command, so to speak, and at what level of certification does this facility have to provide those services? What about billing? Is there any in particular insurance companies or federal agencies that an MD can bill that someone couldn't bill?
In Oregon, I don't think it makes any difference as far as insurance companies and that. Most all insurance companies recognize nurse practitioners and they can bill them. There's no, and Medicare and Medicaid programs do too.
So a nurse practitioner could bill for services and not have to worry about being paid because they weren't at a particular level of certification?
Well, one of the things is that to be, for all insurance companies, a billing provider has to be certified by them. And you have to get in your paperwork. Let's say any provider, a nurse practitioner, a physician, I mean, particularly like Blue Cross, before I even started, nowadays, I have to have my paperwork in about 90 days ahead.
How important is, being you are an MD, we evidently don't have to have an MD certified provider to retain rural health status. Is there any advantage in having one with rural health where you're not required to have one?
Well, with rural health, the regulation is now, is that the clinic still has to have some physician supervision, medical supervision, but the physician does not have to be physically present now.
Is that because of newer technology, or for what reason do you don't have
Newer technology.
newer technology?
Yes, sir.
So basically, nurse practitioner can take it to the clinic and basically put a doc on the payroll just in terms of as an advisor at this point.
Yes.
Okay. And then that would open up everything that we talked about before.
Yes.
Okay.
Do you see any pitfalls in this board contracting with any other provider that doesn't have an MD with their name? Do you see cautions or red flags or anything that way?
Well, if they do that, the physician's assistant, if he works here, has to have a physician supervisor, and currently the physician supervisor has to be on site twice a month.
But that also changes with this last thing you just talked about. You would not have for a PA to work here, because you said before that the physician doesn't have to be on premises. So do you still have, even with the physician and what we were just talking about, nurse practitioners around the place, physician is on contract as an advisor, is that enough for the PA to then work?
Well, the physician, though, has to come to the
They
clinic.
they still have to come physically to the clinic, okay.
If there's a PA.
Okay.
If there's a PA, okay.
The difference is that the federal law says the physician doesn't have to be on site. The Oregon law says that the physician has to supervise the PA.
Okay, so that's Oregon law, and that's where we gotta be. Has anybody got any other questions for the doc? Dennis? No? One of the other things that we talked about in our conversations, because it seemed like these deadlines are really hard to deal with, to do everything the board seems to feel that they need to do, and the processes we have to go through to do them. I asked you if you was willing to continue on providing some kind of services for a period of time beyond what you've already notified the board.
Yes.
How
I
long?
think we talked about the end of July.
Well, I'm just trying to let everybody be informed. So you're thinking that you could hang on to the end of July with, evidently with the needed help, and they have agreed to do this?
Yes.
Okay. Well, that's a break for this board, let me tell you.
Yes, thank you.
Yes, thank you much. We're going to continue on with our regular meeting. If you're certainly welcome to stay, but I have no question. I don't think the other board members have any questions for you. Do you have anything you'd like to?
Yes, I
I have a quick question.
Sure.
Okay, the level 3 certification means you have 24-hour on-call
Yes.
capability, correct? Okay, the
Even
person,
level 1 does. Even level 1
Okay.
requires that.
the on-call person, do they have to have a certain level of certification to be the on-call person?
You have to be a medical provider.
Medical provider,
Yeah,
and
it
so.
can't be a nurse, for
Oh,
example.
can't be, okay, it can't be a registered nurse, so you have to have a nurse practitioner or a PA or a doctor or, okay.
That's correct.
Is there any higher levels that could be obtained by additional services?
Well, they're talking about, above the level 3, they're talking about a 5-star program above that, and I haven't studied that yet as to see what else is required, or if there's any advantage to doing it.
Okay. Now, the level 3 certification, that comes about through the coordinated care organizations?
No, it actually comes from the state of Oregon.
State of Oregon
Yeah,
is
we
separate
actually-
from
It's separate
coordinated
from-
care?
Yes, it is.
So that certification has nothing to do with Oregon legislature passing some kind of statute that permits the funding going on as we know it today? Is that,
Well, what's happened is that with the Oregon Health Plan, first off, the Oregon Health Authority would like every primary care practice in Oregon to be certified patient home at, level 1, 2, or 3. The CCO that we're involved with here, that we're associated with, has actually financially given us some incentive to do that. Now, there's 14 other CCOs in Oregon, and I'm not aware of any of the others doing that.
that's what I was getting at. The assistance you're getting is through the coordinated care organization?
Yes, and another, if you would join a different one, you might not even see that, you wouldn't see that money.
Okay. But right now, we're stuck with that.
Yeah, yes.
And originally, like almost 2 years ago, when the federal government committed to the state of Oregon so many Medicaid dollars to establish the program the state now operates under, and that expires in, I think, 5 years, wasn't it, 5 years?
Well, there's going to be a reduction in 2017. I think it's at least a 10% reduction in 2017.
Okay.
Money from the feds.
And doesn't the Oregon legislature have something to say about that?
No?
So it's all up to the feds,
It's up to the feds, yes, sir.
such as the Supreme Court ruling in the end of the month. How could that affect Oregon or clinics like this, where they're ruling on the legality of the setting up the exchanges in 26 states? Does that affect any of this any of the funding that would be available through Medicaid dollars or Oregon Health Plan?
I don't think so. I mean, Oregon is one of the states that agreed to participate in the expanded Medicaid program, and that's what we're looking at here in terms of these dollars.
And that's what kind of keeps this place alive, isn't it?
Well, in a way, I was, the one thing before I left, I was going to just get, we did our Medicare cost report, and I was going to explain that before I leave, so.
Okay. Okay. You're welcome to stay.
Well, sorry.
Go ahead.
Oh, no, if Doc was gonna talk, I was just gonna go on the public comment piece. Talking to Doc, are we gonna move on past the public comment now? Is that what you're planning on doing?
Well, I'm kind of stalling to approve the budget until Patty Effingham and Alice get here, because we did change our meeting date from 7 to 6. And maybe, well, we know Patty was out of town at the time, but we thought that she got the information, so we're kind of in limbo on the budget stuff. But we could go into public comment.
Yeah, that's what I was gonna recommend is, I mean, with Doc here, I mean, that was great. We got
That
comments.
might be good. You want to stay?
Yeah, I would like to give you a little report on what we've learned this year. Every year, we have to give a report, what's called a Medicare cost report, since we're a federal rural health clinic. And this report is based on what our costs are and what patients we see, and as a certain, to me, it's worse than doing a tax return. But anyway, last year, our report was due, in fact, it was put in just in the mail today. It was due at the end of May. And since the end fell on a Sunday, we had till today to put it in the mail. So we got it done at the last minute. We reported seeing 3,234 patients here last year. Medicare says we saw 973 of those were Medicare visits.
So what was that again? How many out of?
973
Okay.
were Medicare visits. Our cost per visit last year was $134.74. Medicare pays us per visit, or allows $79.80 a visit. So that's a deficit of $54.94 a visit. So for every patient that we see on Medicare, we lose $54.94. Multiplied by the 973, we come out to $53,456.62. That's what your tax dollars are paying for. You guys are subsidizing Medicare.
Okay, what was that total?
What, $53,456.62. Now Medicaid is a little different animal. The state has assigned us a rate over $134, and so we don't lose any money on seeing a patient that's on Medicaid.
And how many patients did you see on Medicaid?
I don't have that number.
It was 33% of the patient.
It's usually about
33%.
Yeah, yeah.
So I would guess, about somewhere over 1,000. 1,100.
You have to add together two columns.
Yeah.
Did she say 36%?
33.
33. So they're paying more than the break even. Do you know how much more?
About $10 more.
About $10.
But actually, that's, the way it works is that Medicaid pays us for some items that Medicare doesn't. So we have to, like the x-rays, if we do an x-ray on somebody, we still get the same amount of money from Medicaid, or if we do a lab test on them. So that's why we get the $10 extra. It's to cover the cost of labs and x-ray and electrocardiograms.
And they don't pay for things that are bundled into the appointment, like the crutch or the braces and things that we hand out here that perhaps people wouldn't hand out in the town.
That's
Yeah.
Medicare or Medicaid?
Medicaid. For like the knee braces and the ankle braces.
Anything under $50.
So who makes up the rest of the patients? Are these private pay then, or private insurance, or you just don't really have that broken down?
Basically, we have some workers' comp. Pat probably knows the breakdown a little better. We have people that have other insurances, let's say Blue Cross, Providence, LifeWise, and that. And then we have, a few injuries, on-the-job injuries,
And private pay.
and private, yeah, mentioned private pay.
So if I have Medicare and I have a secondary insurance,
We still lose money,
because,
because the thing is that they have a cap on what they will pay. We can only charge Medicare a certain level of fee. That's why, even the standard physician's office, people are having problems with Medicare, or going into Medicare, having problems finding a doctor, because it's a money loser. I mean, the reason that I do it is because I feel I have a social responsibility to do it. And I can't make it up in volume.
And that's part of the reason that there's a subsidy involved?
Well, I mean, here, I mean,
Yeah.
yeah, I mean, that's your subsidy, a good portion of it actually goes to cover our Medicare losses.
Yeah.
Now, are you talking about the board subsidy to the clinic or the subsidy from the EOCCO?
Well, we don't actually get a subsidy from the EOCCO, we get payment for certain types of, meeting certain objectives. But, no, I'm talking about the board subsidy.
Okay.
Yeah. It was determined 15 years ago that you couldn't operate primary care without subsidy in this community. And that's why we established a tax base. That's why we have paid a subsidy. That's why we're continuing to pay a subsidy. And things keep changing. So that's why one of the things the board has to deal with is that you have to pay for the services offered with subsidies that match the services. So that's where we're at today, no matter who it is.
Well, rural clinics, a lot of rural clinics in Oregon are subsidized by health districts.
So
For that reason, it's like a school district.
Yeah.
that's the only way they can work.
Only way you can make it.
Yeah. Otherwise, your patient, you would restrict the patients. You would see so much that you wouldn't be servicing the community.
Well, it was a wonderful opportunity when the health district law was passed in 1980, and Condon was the first documented health district in the nation, and Dr. Carlson was the first director of that.
Okay, was there anything else you wanted to pass on?
No, I just want to give you that bit of information, that we finished our reports and that was some information that I knew from it.
Okay. Appreciate that. Okay, well, I think we'll move on then to public comment. You had your hand up, Sean.
No.
Did you have a question? Earl?
Well, just to get the ball rolling, I mean, with the public comment with Doc here, it was amazing, but I mean, and it's good having him here. But I know there's a lot of questions. I know there's a whole bunch of concerns, otherwise you all wouldn't be here. And there were some pretty specific kinds of things that were out there. And if there's anything that we can answer specifically for you in terms of what your concerns were with the way things were going, why we did something, this is the time to do that. You know, I mean, I'm assuming that's why you're here. So I want to make sure that we don't go to public comment and then somebody doesn't get a question that they've got answered. Because there's nothing more frustrating than saying I'm going to a meeting to get my questions answered and not even get a chance to do that. So there were some really specific kinds of concerns that I saw in a number of publications. And so please address those things. Nobody's going to take it the wrong way or anything else, but if it's a specific issue or question you've got or why we've done what we've done up to this point, Would really appreciate that you ask that question while you're here so we can at least attempt to answer it. I can't promise it'll be to your satisfaction, but I think it's something that we owe the group, and I think that's ultimately why y'all are here.
Started 7.
Yeah, they changed the time.
Oh, I'm sorry.
So that's okay.
I'd like to kind of see a timeline of what your process is from here to, say, the end of July. You know, like just a little line graph, this is what we have to have done by such and such, this is what we have to have done by such and such, etc., so that it's very simple.
Yeah, times are going to vary a little bit in terms of who winds up taking over the management of the clinic. Because Pat will need to pick up some stuff and get her stuff put together, someone else may not. The timeline, I'll just start out and then Carl or anybody else just jump in. I feel like I need to go back to the very start on this thing. When Doc said he was going to leave, and I'll just give you my story. When Doc said it's time to leave, we're going, okay, great, it's time to leave. And Pat came forward at that point with a contract and expressed an interest in the job. Up to this point, we haven't negotiated, we haven't come to agreement as to what we can actually do. That's still up in the air, but we talked about advertising the position. Now, I feel really, really strongly in that. It sounded like the reason that the board decided to advertise this position was somehow because we wanted to have a doctor here specifically. Certainly we discussed that, but the reason that, for myself, that I thought it was important to advertise is you're talking about, buku tax dollars going to somebody from a subsidy. In other words, taxpayers are going to pay that subsidy. The stuff that I've always been involved in, the prudent policy is to advertise that position. If you're going to do something like that, because it's tax dollars, and as far as I'm concerned, that's good public policy. Rather than, now granted in this thing, we've got someone here already, but you've got to take it in the large scheme of things.
Is this a financial problem?
In terms of?
Maintaining the clinic to be open, is it financial?
No.
So it's personal then?
No, it's not.
So you have Dr. Carlson oversees this clinic.
Correct.
Now, and he's quitting. So
Retiring.
So you're trying to find a replacement for
Correct.
the new management. And what's wrong with Pat? What is the reasons that Pat can't?
Okay, that's what I'm trying to explain. Whether we advertise for the position or not isn't saying there's anything wrong
Is
with
that
it.
an attorney's advice?
Yes.
Yes. Well, and actually, when we first started this process, we did have to legally advertise. We've since passed a policy where we don't. But I still contend it's good public policy. I'm not comfortable just handing tax dollars to somebody without at least going through a process.
But how long are you gonna advertise?
We're almost done, 30 days. We're almost done.
Is
Is that a correct statement?
Yeah,
Do you represent the bond to float the tax makers for this place, the subsidies, the tax dollars to? Do you represent them?
What I represent is, I have a position on the health district board that I'm elected to. What I represent is being a good steward of the taxpayers' dollars, and I take that really seriously, yeah.
As a board member here?
Huh?
As a board member?
Sure, as a board member here, because I think that's my responsibility as a board member on something like this. Our job isn't to manage the clinic. That's done by whoever's going to be managed it, but my basic opinion of my job as a board member is that to make sure that we're doing things above board.
Well, how many board members do we have that have a medical background?
I don't understand why that's important.
none,
None, so it's all just business.
yes.
That's what it is.
Yeah.
Oh, I just find that odd.
Okay, well, that's.
Well, we have an awful lot of trouble staffing the board with people that have medical backgrounds out here.
Oh, probably.
I agree with
I might
that. I think that if you went into upper management in many of your major health providers, you're gonna find out that they're not all physicians.
No, they're not.
It's business. There's a difference between.
Well, again, we're not in the business of running the clinic. We're in
That's
the
right,
business of
that's
making
what
sure
I'm
the tax
saying,
dollars are
that
going the right
this
place.
is business,
Yeah.
this is not,
Yeah.
you guys aren't supposed to be doing medicine.
I'm gonna further answer part of that question. Since our last regular meeting, Pat asked to meet with each board member individually. We all are in favor of that, and we did. She also asked what the board wanted with the next provider and what we might bring about in subsidies. That was accomplished during our special meeting last Thursday. And the private meeting I had with Pat on Friday, the 29th. And what the board came up with at that special meeting so that we could pass on to, not just Pat, but anybody that was interested in providing the services at the facility here, is that where the board would like to start is we would like to maintain the current services at the current subsidy and maintain level 3 rural health status with a contract to be reviewed in 1 year. Now this is where the board has decided we would start and we would negotiate from depending on whatever proposals is presented to the board. That's our ground floor of starting. That doesn't mean we can't come off of it, we can't go up. It's just, we was trying to get this information out. And we have. And it has been suggested that maybe the easiest way to go forward from here might be for the board to appoint 2 of its members to continue these talks with Pat and have the same format for anybody else that would be interested in providing these services. After which this information and the progress could be brought to the board in a special meeting. Understanding that in the end, it will be a full board that approves or disapproves any matters pertaining to these negotiations. And that, I think, is where we're at. And I think that is reasonable. I think for anybody to come in and maybe deal with a full board, it might be a little bit intimidating, not knowing how easy we are to work with. So it was suggested, and I think it's something that might fit kind of the format that actually Pat has kind of started when she requested to meet individually with each of the board members. I think this is a continuance of that, and whether it's with Pat or with anybody else, I think it is appropriate to do that. And so before we leave here tonight, I will be asking what the other board members think, and we will be asking for a motion to do that. Whether or not it's everything that we need to do, I'm not sure. But it's certainly a place to continue without having to post meeting notices, comply with all the ORS time requirements when you post a notice. It's something that expedites the process. It's still gets the same information to the same people, and hopefully in a timely manner. Because if there's any information that's put forth in these meetings, and if it needs to go to the board, then they can call a special meeting. And we can decide or further talk about it, or make changes and go from there. Right now, nothing is written in stone. Terry?
Well, so, if you're gonna do special meetings, that's just the 24-hour posting?
24-hour posting.
And are those gonna be executive sessions, or are they gonna be open sessions, or are they gonna be a combination?
Well, I'll read what we can do in a special meeting.
I thought it was just you can only do whatever you posted that you're gonna do.
No, you can do beyond that.
Oh, really?
Yes.
Okay.
In a special meeting, you need to post a notice of your primary reason for having a special notice, 24 hours in advance of the meeting. When you adjourn the meeting, any issue brought before the board can be dealt with. You can spend money in a special meeting. You can have an executive session in a special meeting. And that's certainly beyond anything that I ever thought you could do in a special meeting, but that's an interpretation by our attorney, and I think he's getting it right straight out of the ORSs.
So after you adjourn, you can do business.
Pardon?
What you just said was that after you adjourn the special session, you could just go on and do regular business?
Well, you don't have to adjourn. The special meeting is open to the public like this.
Right. But you said, after you adjourn, you can do other things. But that, I don't think that's what you meant,
No, I don't think it was either.
but that's what my notes say.
What I'm trying to say
Might be
is,
mixing executive session and special meeting.
Well, I understand executive session, you can always go into executive session, I mean, and
yeah, well, I always thought a special meeting was limited to what you posted your notice on. That's not true. You can go anywhere else in a special meeting. Because if all somebody's got to do is bring up a topic, you can discuss it, act on it, pay for it, or if need be, go into executive session. You would have to state the ORSs allowing you to go into an executive session, but you could do that.
somehow you got the word adjourn in there, and that's where I got confused.
Okay, well, I probably said something wrong. But
It's okay.
But that's what you can do in a special session,
Right.
which is actually almost more than you can do in a regular session.
Maybe that's why it's special.
But I think that the purpose is primarily to address a primary topic. Generally, when they call a special session, that's your
I think
general.
behind the scenes, the
expectation.
people that wrote the rules realize that you're calling a special meeting for a special reason, and you need to be able to act in whatever fashion you need to act. Oh,
Which I was some grief.
good. Come on then, Alice. Evening, Harold.
Yeah, here's someone to say, have a comment about
I think many of us are concerned about the retention of our current health care providers. I'm sorry, I'm having difficulty talking. Turns out.
I think that's why most of these people are here, is they would like to retain the positions we got now. They're qualified, I understand, with a little more paperwork and
Well,
are you required to advertise for a doctor?
no, that's not what I was asking
Well-
exactly. What I was trying to ask is, or say is, all of it, many of us, or I would say probably most of us, are are happy with the healthcare providers we have. You know, I have had Pat for probably on and off pretty much 15 years, and she has done an excellent job for me. I would be very loath to lose her, and I think that there's many in the community who feel exactly the same. And Dennis, will the board insist on, if you choose somebody else to run the clinic beside her, will the board insist on their retention?
Okay. Well, I appreciate that, Pat. I think a lot of people in the community feel that way, but the board had to get to a position to where they felt they could legally make a decision. We did that last Thursday night. We also determined what the board would ask for. I just read it to you. Now, we can start negotiating with anybody. And I just read you something here that says I would like to get 2 members of our board to start negotiating or talking with anybody interested in providing services here.
Including Pat.
Including Pat. That circumvents all of the rules and regulations. It just lets people talk freely about what they may want. Yes, Trish?
So, you know, I'm an employee, and so I am really seriously concerned. I've been here 3 years, and so I feel like I'm a long-term employee. Sean's been here 8 years, or 11 years. And so, you know, we're concerned. I mean, what if your negotiations don't go well, and Pat decides that she's not even willing to, you know, further it, or decides to just drop it? Where do you have a contingency? What are we going to do? Are we going to have a job because Dr. Carlson is only gonna be here until the end of July. I mean, it's a real concern. Do I start going looking for another job?
I think we need to look up to fax or email, or write letters to, about our concerns to Lakeview.
Well,
And not just leave it up to the board to make a decision. We need the rural persons that look over rural clinics to get involved maybe. Even if we have to get an attorney.
Well, I think I have a valid.
That's the way I feel. So if I have to pay for an attorney to do that, I will.
Yes.
I would like to know if anyone else has been interested besides Pat. And I would like to also state that Pat has taken care of me and the tribe here, as chief of the Conaway tribe. Many of them have been extremely happy with her. And I am just really thankful she's here. And I would like to see her continue because she has listened to us as Indians. And she has made sure that we were healthy, even when there was other ones that didn't. And for me and the tribe that's here, we're very, very concerned that she stays and helps us.
At the present, nobody of any consequence, to answer your question.
Okay, thank you.
Judy?
Yeah, I would like to know what you define as posting for a meeting. If this is a huge county, I live in a dead zone, I can't even use a cell phone at home. Where are these meetings posted? Are they posted online? Are they posted physically somewhere?
They're usually posted at the post office, but someone told me that the online, or the web page was totally outdated, and I'm checking into that. It could be posted on the web page.
I think for like, I'm in Summer Lake, it would be real handy, because I don't come up here every day. And I don't really know what's going on unless, and I don't get radio reception either, so.
You bring up a really, really good point, and I know it's a point of contention for some people, and I understand. You know, because there are certain rules that go with public meetings and board meetings, and that's, you know, you've met now, you get together the next day, if 3 board members are in the same room, theoretically, you should have posted that, and that should be a meeting. But and I know there was a specific incident that some folks had some heartburn about. And all I can say about that specific incident is that we were under the gun. Nobody recognized that more than the board. I mean, we did not have much time to put this together. And the first thing that we had to do, at least in my estimate, and what we decided to do, was to research it. It had been 14 years since we hired anybody here. A lot of public policy changes in 14 years. So what we wanted to do before we started doing anything else was to make sure that we did it right, that we did it fairly, and that it wouldn't be something we would wind up litigated over down the road or something. And I thought that was pretty important. But back to the meeting piece, we did meet one time, adjourned, and then got together again. But the only thing we got together again was for 3 of us to fill out the litany of paperwork so we could get the dang job posted. They haven't been meetings. Wasn't a meeting. It was just a work session. But because everybody that works is also board members, and we don't have the luxury of a large committee, some of the things aren't going to run, exactly by the book sometimes. And I apologize if there was a misunderstanding about that, but I would defend that piece. I'm just saying,
Is it possible to do like bulk mailings or anything like that?
No. The best you could do is, and that's what we all live with out here. I mean, in terms of the distance and stuff, it's just difficult to do that. I know that Terry's got some pretty major issues because the only folks that are doing most of the advertising for the elections are down in Lakeview, and nobody reads, the Lakeview piece. I mean, that's something maybe we get together with our local media people and try to do a little better job. Upgrade the website so at least anybody with a computer can get it instantly posted on the web.
But even this post office thing for me is an area of contention. I don't have a post office. I get delivered on the highway, so I'm not running up to that post office every day.
Then
And I
we need to
shouldn't
look
have
into putting it on the webpage. I'm
Right,
trying,
I think
I'm
that's a
trying to
great
find
thing.
out who set up the webpage for the Medicaid clinic, and I have not been able to find
Yeah.
out.
We might just have to take it in and just have another webmaster put it back together. That sometimes is what's involved. But I think, you know, if you're gonna post more than towns, put it in the grocery stores too. I mean, we can probably go to the grocery
Well,
store every
I know we
day.
did with one special meeting, the last one, everybody was here, was posted in the restaurant, there's a couple of stores.
But, yeah.
I mean, I went down to the post office, I didn't find it anywhere, and then I found out from a friend about this meeting, and
This one here?
yeah.
Oh, it was posted,
It's
it was
been posted for
I
4
didn't see
days,
it.
and
I
it was
went in
there,
and
I
saw it.
checked and verified.
But I don't have a webpage.
Yeah. It is a point of contention because you put up notices and maybe someone takes them down, but I know that.
Or change them.
Very aware and, or change them.
Because the one at the post office said 7 o'clock, that's why I showed up this evening.
Yeah, but anyway, I checked on this and that one was been up for 4 days.
With the wrong time.
But to further expand on what Earl was commenting why we had our meeting, during our special meeting, the board had approved to advertise with rural health. Then we were given these 4 pages of stuff that had to be filled out that was pretty technical with all the language and everything that we had to fill out before rural health would accept the ad. So that's what the continuation of people getting together was, and we stuck with it, and we didn't take a break other than eating while we were talking, and at 10 minutes after 2 that day, our ad was completed and filed with rural health and on the internet. And rather than being criticized for it, I think we should be thanked.
One other possibility that I've seen work pretty well in rural areas is, and I mean, initially it's kind of a pain in the neck.
Here's what?
Well, it's a pain in the neck initially to reach people, but it is a very effective way if once you get it in place, which is to have people sign up to be on a bulk text message, just like what the school does. You know, when the school has something where it's like we're closing the whole school because the pipe broke, every parent gets a text message. And it's one button. It's one button. That's all they push is one button, and it goes out to everybody.
Well, it goes,
Yeah, but the problem would be, it would almost have to go to every person in Christmas Valley then.
No, it would be every person who signed up to be on the list.
Oh, I see what you mean.
Every person who signed up to be on the list. You just keep typing names, and then you just push a button, and it sends that message out to everybody. And that covers a huge gap that when you're in this huge geographic environment would be, I think, something to look at down the road.
I think that would work in addition to it, you couldn't do it until, we still would have to post it. in the
I'm
other
saying in
place.
addition
Yeah,
to,
yeah.
absolutely.
How do you suggest we get those names where it has to be?
Put an ad out that
some way?
says this is what we're doing, and if you're interested, give us your phone number.
Would you be willing to run that in the paper for us?
Well, sure, I think both papers and all papers should, and then posting. It's just a thought, but I think it's a good option.
Those are all good thoughts, but your paper comes out once a month.
Exactly, that's why it's not.
And the other paper comes out twice a month.
Right.
We've been meeting 2 and 3 times a week,
Right.
trying to go through some of this stuff. You gonna do it?
Yep.
Thanks, Doc. Appreciate your time.
And what I'm saying, this is not the norm, this is not the normal situation. All I'm suggesting is this is something to look at in the future. When you're hearing this, you know, kind of this comment, we didn't see it posted, and we didn't, you know, it's just another avenue to reach the
Okay.
public. And that's all, just a
Certainly we
comment.
can consider that, and we're doing what we've been doing for
Right.
the 15 years that I know about.
Technology's changed in the last.
And what the other boards in the community also do.
Yeah.
Everybody's doing about the same thing. But if anybody's got any further questions, we leave some business cards out on the table over there, so if you leave, if you want one of those cards, or so that you could call somebody and find out factual information. or have just questions for the board about anything, we're available. So it's in the future that
Carl,
hopefully you can do that.
Can I make a really quick comment? There's a few folks that just came in late, and I know there was some concern in the back when we talked about the notices, that this was originally scheduled for 7 o'clock. For those of you that just came at 7, if you didn't get the notice that it started at 6, I apologize. The reason for that was because we wanted Dr. Carlson here to answer questions, and he couldn't be here later than that. He had to be here at 6. And that's why the 7 o'clock in the paper changed to 6, but it was, you know, in the normal places that we put it up. But that's why the time got changed, just for folks.
And we normally do that several times a year when Doc is here. If he's coming in because he has to leave. He stays over from his day at the clinic, and then he comes and gives us information. We talk back and forth, and then he tries to get out of here. And that's what happened tonight. Yes, sir.
Yes, just one question. Am I gonna lose my doctor?
There's what?
Am I gonna lose my doctor? And if I am, I'm gonna be damn upset about it.
Well, I appreciate that, but you wouldn't be the only one. But I don't have all those answers.
When will you have those answers?
Well, the doctors agreed to stay on through the end of July. We're trying to find out what we can do, what opportunities are available to us, and then we have to look at that information and go from there.
If the board is satisfied with the doctors we have.
Yeah.
No, he said did you say dissatisfied or satisfied?
Dissatisfied.
No.
It
No.
sounds kind of personal.
No. No. If you didn't hear what I read a little earlier, what the board had agreed at a meeting on Thursday,
Yeah, which, anyway.
that what the board wanted initially was to maintain the current services at the current subsidy and maintain level 3 rural health status with the contract to be reviewed in 1 year. So we're happy with what's going on up there.
So currently Pat doesn't qualify for that position, right?
She does, absolutely.
Yes.
So
Sean.
only the board can confirm that she can stay or go.
In the end, yes. Sean.
Could you possibly change that 1 year to longer? Because of from what I understand, there's a risk usually of any business the first year.
I don't believe so, Sean.
Why?
Why? Is because it's something that was thought to be important at the time. It is also something that is thought to be important by the Special District Retention of Best Practices Act. It's in their language right here. Is that most contracts are written and automatically renewed after a year. It's hard to have a multi-year agreement.
And bear in mind that that contract renegotiation would benefit the physician or the manager or Pat or whoever's in the position.
I understand.
It could benefit them as much as it benefits us.
I'm not saying you should.
Yeah, no, I hear what you're saying though, in terms of retention.
Well, is that what you have with Dr. Carlson now?
What?
Is that what you have with Dr. Carlson now?
Yes. Yes, it is.
Every year?
Yes. Judy.
This is something I've been thinking about for about a week, but in the process of gathering information, which is what you've been doing, is there anybody on the board that utilizes this clinic for their primary health care? Any member of the board that
How many times have you seen me, Pat? Numerous times. Is she the only doctor I go to? No. I go to Ben Urology because you don't offer that service here. I have went to our doctor in town years ago because you don't offer that service here. But when I had a great big swollen toe, I was sitting in one of those offices up here. So for me, I go in there. I had a checkup a year ago with Dennis, wherever he is. I use it some, not exclusively.
Does anybody else on the board?
I see a doctor maybe once a year.
I don't go to the doctor that often, but when I was having some serious neck problems, Pat took care of me. And I had a problem with my leg last year and had to have some surgery, but I ended up having to go to Bend to a doctor for all of that. Yeah, I utilize Pat when I need to. I don't need to go to the doctor unless it's something that pops up.
I haven't. I'm fairly new around here. I had my primary care physicians when I came out here. I haven't changed over yet. Honestly waiting for a time to do that, but you know what, that's part of the conversation, that when we had the opportunity to start over, not that Pat isn't going to be perfect for this thing, but it gives everybody an opportunity to take a look and say, where's the level of service? Is there something we can even do better? And pull more folks like me into this thing and make this clinic more responsive to, you know, I mean, the demographics have changed out here over the last, 5, 6 years. There are more and more folks like me that are sort of retiring out here with a second job. And that was part of it. Now, that isn't saying that Pat can't make those improvements in the clinic too. But we just have to, you look at all those kinds of things. And a time like this is a really good opportunity to take a look and say, what is working well? What's not working as well? That's why in the paper a month or so ago, we had an article out there saying anybody, employees, anybody in the community, if you've got questions of the boards, you've got recommendations, you've got concerns, call one of the board members and let us know. We really haven't done this in a vacuum, but it feels like that, I know. And that's unfortunate.
Dennis, the lady sat next to you, yes.
I'm Vicki, and I'm just new here. I've only been here a year next month. And I came from the coast, South Coast, and a little community called Powers. And there they had the water polo clinic. They had one receptionist and one, she was like Pat. She was a nurse practitioner. That was only people like that. There's only like 450 people that lived there. Not one person ever complained about Mary there, ever. I'm here all the time. I see Dennis on a regular basis. I've seen Pat a couple of times, and I've always been treated fair here. I don't have no complaints, but I don't have no complaints about the board members up there either. They're trying their best. I know Carl, and I know from the past, and I know he's got a lot of burden on his shoulders too. And so I'm not going to take sides here today, but I don't think Carl's, the board is being treated totally fair. You need to give them a break, that they are trying their best, I think. And
well, thank you, but actually the census that we do monthly, that Pat actually does, shows, like Doc said, in the year 2014, you had over 3,300 patient visits. That's a lot of people seeing the providers. And what Pat says, you got about 2,000 that are regular patients for this clinic. That's a lot of patients for a small clinic.
Yeah.
We realize that. We realize that the services here are vital to this community.
Yeah.
Well, how many ambulance runs do you think that this clinic here saves the EMS? Sue?
Quite a few.
Quite a few.
Quite a few.
Just
If
having
the
this
clinic was
facility-
not to be here, it would put quite a burden on all of our personnel.
It certainly would, and we realize that. And we're trying to do what we can, but we have to act responsible in whatever we do.
Does your
Yes.
plan include a second provider, or would it include one provider working on their own for all those patients you just mentioned?
Well, no, that's up to whoever the provider would be. We don't want to go up there and tell them what to do.
Oh, I see.
We don't
So
now.
they-
We hired Dr. Carlson, and we don't want to talk to him. He's up there and we're over here. And we'll let him do what he wants to do. And that would be the same with anybody else that would come in here.
Actually,
But don't you have to approve a budget for that or
well,
something?
but during the discussions we had on that very thing,
Was it in the budget?
yeah, the budget.
Not the budget for the clinic itself.
Well, no, we don't do his budget. We do our budget.
Right.
And where the clinic comes into play in our budget is the subsidy.
Does it cost more to subsidies two providers than one here? Or is it the same?
We leave that up to whoever's up there.
Yeah.
We'll let them figure that out, because right now you have two, you might say, part-time providers. Dennis works 10 days a month, Pat works 12 or 13, and that gives full coverage for the month. That's two. It could be one, but that wears somebody out. This is what Pat did years ago. And finally, she got wore out, and she didn't want to do that anymore, and I don't blame her.
That goes right to my
So
concern why I
Dr.
asked.
Carlson brought Dennis on board, and that kind of gives Pat a spell and what she had to do up there, because it's, to work 10 days would be tough.
Well,
And they're not short days.
I have to say that I worked 4 years in Alaska as a solo provider, and I didn't want to see a patient as long as I lived after I was done with that.
You know, and that was actually part of the discussion that the board had when we talked about that, because initially we had said we would like to see it staffed with blank, 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 blank. And then, you know, Patty brought up a really good point of saying, wait a minute, nobody wants to be micromanaged, and Pat included. So why would we try to set up a clinic and tell them how they have to staff it? That's why we went with, we want to maintain a level 3 rural health clinic, because within that deal itself, that creates a certain level of staffing. And that way you've got people on call after hours if something's going on and stuff. So that's the entire point of what we're doing, is to make sure that we don't drop the level of care. And one provider can't do it.
Yeah, you'd have to have 2 providers if you're going to provide after-hour service.
Yeah, and that's what a level 3 is gonna
Yeah.
mandate. That's why we did that specifically that way.
Because of the extra money that brings in to do that.
In terms of,
Well, you said that why you decided on the level 3.
well, the reason my personal thing, the level 3 decision for me was level of care. Because, and meaning that you're gonna provide the after-hours stuff, and you're gonna provide the other kinds of things that we're already doing. And there's also some subsidies that do come along with that, which helps, you know, with the provider that's gonna take over. Yeah, it does bring in that wraparound. Yeah, but I think that's important. I think we need to take advantage of all the subsidies we can get in an area like this where we're, you know, relatively underserved.
Yeah, the terminology that Dr. Carlson used was, in explaining that, is he doesn't consider it a subsidy, but it is an income. Yes, sir, somebody had it.
Yeah, I did.
Yes, sir.
Yeah, I'm her husband.
Okay.
I'm Trish's husband.
Yes, Mr. Brown.
Yeah. What are you gonna do if you, say, hire a different provider and they say, I want my own staff? Are you gonna hand everybody your pink slips?
Do what?
What if you hire a different provider and they say, I want my own staff? I'm gonna bring you my own people.
They don't retain us.
If we hire another provider, it'd be up to him who he brought for staff.
I'm saying, you can hand all these people.
Is that what you mean?
Yeah.
No, I think what he's saying is
Are you gonna make them
somebody's gonna
stay, you
wipe
keep
out
the staff
everybody.
here?
Just one at a time, please. What?
Is the
Terry?
staff gonna be here?
I think what he's saying is if some provider comes in from out of the area, are they just gonna, people are concerned that they may just walk in and just change
Okay.
the entire staffing process.
Let me,
And
I can answer
understand that.
Okay. One of the things that we did,
Mhm.
so that if somebody applied to be the provider here, we wanted to offer any information we could about the ongoing services. So we asked Dr. Carlson if it was permissible that we survey his employees to see if they were willing to stay on with a different provider. We took that survey. We have that information. So, and the employees know that. And we asked a lot of stuff in that survey. We was trying to get information. One of the questions we asked is what improvements could this board make? What things would they like to see the board do different? However, that information is not going to be passed on to anybody interested in providing services here. We'll cut that off the sheet and pass on the names, the resume for that particular employee. So we're doing as much as we feel we can to get your qualifications out there to someone that might be interested in providing services here. We've already done that.
Well, and speaking for myself, and I'd like to think the rest of the board is, nobody's interested in that avenue. You know, that's not what we're looking to do. That's why we, even when we advertise, we're gonna have interviews with these folks. You know, and that's what we wrote in the thing, is trying to maintain the way it was. I mean, nobody in this on this board that I know of, maybe I'm speaking out of my, some, let's say knows, that, nobody's goal is to have anybody lose their job. It would be great if they could just roll along the way they are, but the reason that we're doing what we're doing is it's sound policy, and it's not gonna come around and bite us later on. We've gotta do it the right way. We can't just, a couple people say, we want this person, so we just take this big chunk of tax money and say, there you go. It just isn't that simple. It just isn't that simple. Huh?
You said a couple of people, you're talking about 90% of the community that wants Pat to stay.
I don't know that. I have no idea whether it's 90%, but I certainly didn't mean a couple either. There's more than a couple here, so I apologize if I made that sound wrong. I apologize.
You just can't really be sure about jobs. I was in the same situation 4 years ago where there was a change of leadership by the health district board at Condon, and I didn't have any control over my job at all. And so I think this discussion, whether your job is secure, is really should be discussed at all, because we don't know. It's the board's responsibility to find a director of the clinic who can be the provider perhaps, but also the employer. Now, whether that employer wants to hire the existing staff is up to that person. And they can apply for their jobs. Simple as that.
Yep.
And I have to do it too.
For the record, I want to say I'm way less concerned about my job than the future of the clinic and the community.
Amen.
Yeah, an awful lot of people might go without medication until get things straight.
We understand that, and I just gave you some of the stats to verify that.
Yes, I know, but it seems short to me.
We can't wave a wand and say somebody's gonna go to work.
Well, in a way you could, because you could approve Pat now.
There's
You
limits.
could do the paperwork and proceed on the assumption that Pat is qualified.
We have not disqualified Pat in this process at all.
Well, that's your whole job.
It sounds to me like it's getting kind of personal.
Yeah, that's what I said.
We're trying to
It's
avoid
like
that.
one or two members on the board that's got a dispute with Pat. Otherwise, everybody wants her. Ask all the patients to come here, do a survey, and get their opinion. If not, we should find out where to go about the rural clinics. There's got to be somebody in Lakeview that has a concern, because this is tax funded part.
Well, there is people concerned. I talked to the commissioner yesterday, Mr. Ken Kestner. We had a conversation about the clinic. He's offered the help if there's anything that he could do to assist us or work with us. He asked some questions about whether or not we had advertised with the rural health department, which we have. And he was just wanting to know how things were going, and it's a challenge.
Yeah, I just want to say that I think everybody here and any of the patients that's been coming here approve of the staff you have that are operating this place now.
Okay. We don't have that.
Board members.
We don't have that staff. We don't operate that clinic. We hire the person that does.
But you've got that.
Is there anybody else? I'm going to close the public comments period here in a little bit. Yes, ma'am.
I'm Reverend Susan Birch. I'd like to know if Brad Winters was also contacted.
If we have one.
Brad Winters was also contacted.
If who?
Brad Winters.
County Commissioner Brad Winters, was he also contacted about
I just
what's going on?
stated I had a conversation with Ken Kester. He's one of the 3 commissioners for the county. I had a conversation with him yesterday. I'm sure Brad Winters is very informed.
I think Brad's still off the table right now recovering from surgery.
Well, and just
Could we just all get his address or how to get in touch with him so that we can have
That, you know, and you're more than welcome to do that, but just to add some information to it, I talked to Ken also today, and Ken basically said, should I be at the meeting? I said, if you want to come to the it's great. He goes, well, what's it about? I said, it's about the hiring. And then he goes, I have no jurisdiction. That's between special districts.
Yep.
He says, as a county commissioner, I have absolutely no jurisdiction over who's hired or fired in that clinic. It's not going to be my role, so another county commissioner wouldn't change
There's got to
it.
be somebody that cares.
We all care. If you want a phone number, I'll give you a phone number.
I wouldn't be doing this if I didn't.
No, I'll find out. I'll find out.
It's 947-6003.
Well, he may not be the one I want to talk to.
If you want to talk to the commissioner, that's what you're going to call. Yes, Pat?
Carl, is there a cutoff date for the application that you are advertising?
Not until it's filled.
Not
There
until
has
it's
been a
filled.
cutoff date in the ads that we have committed to pay for so far. That was a 30-day advertising period. When that 30 days is up, if we do not have a provider, we have the option of extending that advertisement or canceling the advertisement.
But then you have no provider.
What?
But then with Carson
Yeah,
on,
that's the reason we did it 30 days with an extension. Let's say that Pat had decided she didn't want to do it, and we were not a provider. Then you have a 30-day period and then you can extend it after that. But by doing it 30 days, at the end of the 30 days, you've now you've fulfilled your requirement necessary for advertisement, and you can go ahead and appoint.
that's why I'm asking.
So in other words, if we're going to go into negotiations with Pat, we can legally do that in about a week.
Okay, that's what I'm saying. You intend to negotiate at the end of that.
So your ad's out
Did
about.
that clarify it?
Yeah, does your ad run out in about a week? Is what
When
you're
does it
saying?
run out? It's, I'm going to say close to that.
When did we have that meeting in the restaurant?
A couple weeks ago.
That was the day we got it to rural health. That's just been a week or so. Was that about a week?
That's been a couple of weeks. Easily two.
May 15th.
Yeah.
Or 2nd. Trish.
So, am I hearing then that after your next week is up, you guys are gonna negotiate with Pat, or not?
We're willing, I'll read it again. Since our last regular meeting, Pat has asked to meet with each board member individually. We all are in favor of that, and we did. She also had asked what the board wanted with the next provider and what we might bring about in subsidies. That was accomplished during our special meeting on last Thursday, 5/28, and the private meeting I personally had with Pat on Friday, the 29th. What the board decided at that meeting on Thursday, where we would start our position for asking for a provider was to maintain current services at their current subsidy and maintain level 3 rural health status with the contract to be reviewed in 1 year. That's the position of the board today, tonight, and that's where we're going to start. It has been suggested that maybe the easiest way to go forward might be for the board to appoint 2 of its members to continue these talks that Pat started with us individually. After which this information and progress could be brought to the board in a special meeting. Understanding that in the end, it would be a full board that approves or disapproves any matters pertaining to these negotiations. I don't know where else we can go. And later in the meeting, and the appropriate time, I'm going to ask for a motion to appoint 2 of the board members to negotiate, whether it's with Pat or any other applicant. This format we're going to try to use no matter who we go to or who we talk to.
Okay, thank you.
Aren't you still looking at now about a 2-month deadline instead of a 1-month deadline? And there's a certain amount, the gal from Rural Health at that May 15th meeting said there was quite a bit of time that it took to process all the paperwork. So how much under the gun is the board in filling this and getting the paperwork done to keep the clinic running?
There's some things that are pretty simple to do, some things are not. Some of the things that the board would have to do is to determine whether or not we would want to have some of this in our contract agreement. Such as, would we allow a provider to come in here that wouldn't provide personnel capable of doing x-rays? Such as one of the concerns you had. Would we allow that, or would we require the provider to make sure that someone was on staff that could do that? The second part of it, which I think some of the people missed during our special session, this one special meeting, is what I asked when I asked Dr. Carlson, what goes on beyond someone up here taking an x-ray? There's an agreement in writing with Central Oregon Radiology so that they can do this. It's communicated back and forth. That is pretty simple to take care of according to the doctor. Just some of the stuff like that the board has to be aware of and make sure it's done. What the board has to decide is whether we start putting all these requirements in our agreement, because it wasn't in our previous agreement. Does that clarify anything?
Well, no, I'm just thinking that it was, you had 6 weeks when I was at the May 15th meeting, now you have 8 weeks. You're still looking at a very compacted timeline to get done.
Yeah, it's been compacted from the start.
But it's getting closer.
It is, and I think what you're, what I'm hearing you say is there's certain things that any provider, some provider would have to probably do more than another provider in terms of doing the initial paperwork that need to get done.
Well, they all have to credential and.
Yeah, but there's other things in terms of setting the building up and things like, I mean, every provider is going to be a little different in what they have to set up. And we'd be trying to give them all the time that we can on that, but.
They're looking at 30 days, about 30 days for billing.
One of the other issues that the board was concerned about initially was when we found out that Dr. Carlson was maybe the holder of the rural health status this facility has. That rural health status is important to the provider and the district because it determines what the reimbursement rate is going to be for services offered. We thought that if Dr. Carlson left, that this facility wouldn't have that classification. We'd have to start over from scratch. It turns out, from our meeting with the special health or rural health lady, that that's not true. That rural health status is given to this address. That's us. So we have the rural health status. And any provider to continue providing services under that classification would be, I believe, the board is understanding that it's just a matter of paperwork. Does it take time? Yes. Everything takes time.
Carl?
Yes.
Under the Rural Health Clinic Act, PL-95210, regardless of who the provider is, a physician must be a director, a physician director in order to do that. There has to be a physician director, not employer, but director, to be able to meet that rural health status.
Yeah, now those are the things that we have to be aware of so that when we contract with someone, they have the proper certification to give us the rural health status so that they get the right reimbursement.
That's right, yeah.
That's part of what we're trying to do here.
You could have a nurse practitioner running the business, but a physician would have to just be in place as director.
Yeah, I think we could have just a local citizen run the contract to provide the service.
You could.
But he would have to hire the personnel that was qualified.
That's right. That's absolutely right.
Yeah.
Yeah.
So this is why it was really tough to fill out all the paperwork for rural health on our ad, because we had to cover all of these bases in our terminology. It wasn't easy, but we did it, and it's done. Anyway, Sue, you got any, Teresa, you got another?
No, I don't have another question. I just want to say that I'm not trying to be, you know, a hard.
Say it, just say it.
You know, I appreciate what you guys are trying to do. You know, I know you're in a hard position. And I'm just worried about the clinic, not only about my job, of course I'm worried about my job.
Yeah.
But, you know, I'm worried about the clinic also. I'm in changeover. I am currently going to school for billing and I'm just, you know, want to iterate that it does take time to get all that stuff changed over. It's not as easy, simple matter, and Sandy knows, it's not a simple matter to just say, oh, I'm gonna bill here. It doesn't work that way. So, you know, and I just want to see a smooth transition and for everything, you know, not being interrupted. I don't want to see patients decide that they want to go somewhere else, I guess, because then if you do, once they start leaving and going out, you know, they decide they're going to go to Lopine or they're going to go to Bend, you know, because they're not going to be here. You know, it's going to be hard for another provider, Pat, whoever, to if you don't have your patient count, you're not going to make your bills.
That's
You're not
right.
going to be able to do your stuff.
We understand that totally. There's all kinds of implications if we didn't have services here. But in some ways, we're limited to what we can do.
I understand that, and that's what I said. I understand you guys are in a hard spot.
Okay.
I think
Okay,
what we're trying to convey.
one more question, and then we're
Okay,
gonna.
I think what we're trying to convey to people here is that we would appreciate the board considering Pat first. And you do whatever you gotta do legally. But the people want Pat here, and we appreciate the board.
Amen.
We appreciate the board considering the patients in your equation for what you're gonna do.
Thank you. And with that, I'm gonna close public comment.
Can I say one more little thing?
You're not,
Just one more. No, I'm not public, but one more little thing from the board. It's wonderful to see everybody here with some interest too. And just to let you know, next year around budget time, we'll have a citizen review of the budget. We can have one person per board member. It would be great to see some smiling faces to help us with the bloody budget next year.
And if we need more money, let's talk about floating a bond on taxes. I think everybody be willing to pay just a little bit.
Well, actually, we're in pretty good
For the
shape on
money
that.
to come in.
Yeah, we're actually in pretty good shape on that, I think.
but thank you.
Thank you for coming.
You know, I'm gonna ask for your comment because you haven't said anything yet.
Hi, are you talking to me?
No.
You're agent, huh? Me. My name is Shirley Williams. I'm a newbie here in the area.
Hi, Shirley.
I've been here since the summer of 2007. I came from the low desert in Yuma, Arizona to the high desert here. I
Good
met
choice.
Pat the fall of 2007. I'm 83 years old, and when I was 40, I had high blood pressure. I've had nothing but problems with that. I came here in 2007 to Pat. She took me off all the drugs that I had from Yuma, put me on the first time in my life I have had regular blood pressure pressures. Do you guys realize how highly she is thought of by the doctors that she has recommended me to in Bend? I've had a pacemaker, I've had knee surgery, I've had cataract surgery, I've been the whole, and it's all doctors that know her. I don't know what's wrong, that you just can't say yes. I just don't understand it. I've been president of board of directors at the church in Yuma, Arizona. I've been the president of the Helping Hands in Yuma, Arizona for 2 years as their president on the board. So I know what it's like to serve on a board, you guys, but I don't know. Both Pat and Dennis are thought of so highly by your doctors in Bend.
Are any of those taxing districts though?
Excuse me?
Are any of those taxing districts? The board of directors for taxing districts fall
No,
under some different
nonprofit
rules?
organization.
Yeah.
There's no-
Yeah, because I've been,
Yeah, but you still have a lot of responsibility. Thank you.
Well, Carl's a great businessman, I know that, so I know he'll come up.
And plus, in fact,
Take their
the
advice.
night that Gary almost got his thumb cut off, they were here at 7 o'clock at night to sew him back up.
Yeah, and they was here yesterday fixing maybe a broken arm or something, I don't know. But anyway, they're on call and they provide the services, and that's
right.
We would like to continue that line of service.
That's right.
Okay. With that, public comment is closed, and we'll continue on with our regular agenda.
If you're sleepy, stick around. I promise you, they'll put you right out.
So, like I've already read 2 times, maybe 3 times, that I think to continue the process with our current provider, and would also, this format would be offered to anybody else interested. I'm going to ask that the board, I'm calling for a motion for the board to appoint 2 members of the board to continue or start any form of conversation or negotiations that would be worthwhile to advance clarity and possible future employment of a provider, new provider. Because Pat would be a new provider, new contractor, a new contractor to provide the services. So with that, I would like a motion to appoint a couple board members to do this.
Well, I'd move. I so move to appoint 2 board members to start negotiations with current folks that we will be.
Could I get a second?
Sure, I'll second the motion.
Okay, all in favor? Aye. Now, for the 2 board members, which 2 is volunteering? I'm suggesting that Alice and Kathy try to negotiate the initial steps through this process.
I think Earl would be a better fit,
Diane?
just because, well, then you've got, because men and women have different perspectives.
Nuh-uh.
And I think that would create a better balance.
What's your thoughts?
I tend to agree. I think Earl has a lot of background in the different boards that he has been on before.
Okay.
Some history there. I'd be willing to join Earl.
Okay. Would you favor that?
Yes, I do.
I'll favor that. So,
Usually this happens to me when I go out of the room to go to the bathroom.
okay, all in favor? You move, and then a second.
A second. I'll second.
It's been moved and seconded to appoint Alice and Earl to act as the initial negotiators for whoever we negotiate with. All in favor?
Aye.
Aye. Thank you, appreciate that. Harold, I'm glad you're here. We've got some information for you. Mr. Miles has volunteered to be a board member because we're 1 board member short. When we met with our attorney a week or 2 ago, we tried to discuss all of the different things this board has been facing. And one of them was a relative volunteering to be on the board of a potential health care provider. And I thought, Harold thought, that a relative could serve as a board member and participate and discussions about actions the board may take, whether they involve his relative or connection. As it turns out, the law has been changed. And you cannot, as a relative, comment on any action the board would undertake involving if you have a connection with the party being discussed. Can't even be in the discussion. So I'd just like to let you know that as you have been sitting in the audience and interested in this board, the board has recognized you and received your comments and welcomed them. But for you to be on the board, I think would hamper you being able to express your feelings. And I think at this time, especially since the board may be negotiation with your sister, it is a conflict that I don't think this board is willing to undertake. I think that the board maybe could be better served to continue with a vacancy until we find a member that doesn't have that close a connection with any potential provider. I wanted to try to explain what was explained to us, whether it's good news or bad news for you, I'm not sure. You might not want anything to do with this board. But anyway, I wanted to let you know that we were trying to find out legally, if we got you on the board, what would be the benefit of you? And it would be no sale. You'd have to sit over here and not partake in anything that the board would be doing in regards to your sister.
So when did the law change?
Don't know. He just said that the current law is.
It's been that way.
It's been that way for years.
But having said what he said, if you want to be on the board, you're more than welcome. Recruit you can either, recruit yourself from this or, take on afterwards. I mean, you've been a great help during the budget times and stuff like that. I don't want to dissuade you.
You're off sitting in the audience.
Well, you are right now, yeah. You are. But this isn't going to happen forever. So.
Yeah.
And that's exactly what our attorney said, that you would be better off as a public member of the office, or in the audience, to be able to comment.
Sorry, I was hoping you'd take my place.
Used to be only conflict would be on vote.
Yes,
yeah, that's the way I understood it.
Me too.
And he said that was the case.
But evidently, it's not today.
Thanks.
Pat.
I think that when you're in a rural community and you have small boards, you need to be a little bit careful. Because if you follow that rule, Alan shouldn't have said anything because he was married to my grandfather's. His grandmother was married to my grandfather. So Alan already has ruined himself.
You've been here too long.
The fact that you know that.
Yeah.
But that's the problem. And then my son married all these people, and so I'm intermarried, so half the community can't sit on the board.
Great. Oh, wait a minute.
Okay, well, I wanted to express that. But anyway, next item on the agenda is the financial report. Patty is our dollar gal. Let's do the financial first.
Okay, so we are, total expenses in this fiscal year is $143,000.
Our total expenses.
So, we're trying to keep that under 150,000.
Okay.
Otherwise, we have to have a very expensive audit.
Okay.
So, I think, see, this is June, this paid, actually, we're over already.
We are.
Yeah, we need to sign, we just signed the $8,000 check reduction cost.
So we're gonna be over
So
another last.
we'll be over, that's 151,000. So we'll be over.
It's audit time.
Yeah.
Probably not a bad time to do it right now.
Yeah. So it'll be about $5,000 is what the cost will be. It's been a few years since we've had one, because we've been under the 150, so,
Okay.
yeah. So just be prepared for it.
Well, we're gonna be adopting the budget. We can make a note.
Yes, the audit and legal, we have 6,000. Yeah, we have 6,000 budgeted for audit.
Was that one? Yeah, that was one we were gonna reduce, that's, we're maintaining that 6,000.
Yes, we did.
Anybody got any questions about the expenses for the month? For the,
Michael Bolt, he's the long guy?
he's the long guy, and we're probably at the end of all of our issues with the irrigation. It's just a matter of maybe refining the programming now. Everything else seems to be working fine. And we're not flooding the streets anymore.
I move we approve the financial report.
Second.
Okay, we got a motion and a second to approve the financial one. Any discussion? All in favor?
Aye.
Aye.
Okay, so one other question on this. We have we have $95,037 budgeted to transfer to the building fund.
Yes.
And when we were working on the budget, we decided that we would do about 40,000.
Somewhere there.
In that vicinity.
And didn't we change that when we found out that we needed the clean-in lady?
Yes, we changed the amount, yes. We reduced the amount that we were going to transfer.
By 7,200?
I believe that was what it was. Yes, we budgeted 7,200. So we reduced the amount we had talked about. But my question is, we will not meet again, at least for budgeting purposes, before July. And so I need to make that transfer if we're going to make it before July 1st. So you guys need to approve that transfer tonight.
What about if we're gonna be faced with the audit, should we include those funds also?
We've got a line item for that.
Did we include enough in our line on it?
Oh, yeah.
We did?
Yes, we did.
Oh, okay, well then we don't have to transfer for that.
Not for the
No,
audit.
I'm sorry, making the transfer from the general fund to the building fund.
And that was 40,000, right?
Yes, and that is, yes.
Well, if you've got to have it, I'd make a motion to transfer the 40,000 we agreed upon.
Yeah, because we will be beyond our date with our next regular scheduled meeting. Okay, well then, do I have a motion to make, so move? Okay, we have a motion. Have a motion and a second to approve the transfer
Of 40,000?
of 40,000 to the,
To the building fund.
to the building fund.
Did you second
figure.
it, Kathy?
Pardon?
Seconded.
Alice?
Oh,
Alice.
I think Alice seconded it.
No, if no discussion, all in favor?
Aye.
So moved. Okay, now you want to go into,
You want to do the other one? Okay, one other question. I have a bill for the ad, this, for the rural health, for $120 for 30-day posting.
I have that on here somewhere. I was going to make a motion to
Approve.
pay for
Okay.
advertisements. We'll probably have another one from the Ben Bulletin.
Okay, I haven't pursued it yet.
This is something that we agreed to in our special meeting to advertise with rural health. We previously agreed to advertise with Ben Bulletin
And also, Lake County, but that hasn't
And-
come out yet.
and the Lake County Examiner also. And so we, it's only fair that when we get the bill, we send them a check. So,
Tends to do business better that way, yeah.
But I thought we approved that.
We did.
I don't think we've approved it.
I don't think you approved to pay, I think you approved to do it.
Oh, okay.
Yeah.
There's a difference.
So I think the board needs to get a motion to pay for
Can we
the
make a single motion
advertising.
to include them all, even though we don't have the other bills yet? So we can do this
We
again?
pretty well know what they are.
Yeah, so I'd make a motion inclusive to pay for all advertising associated to the ads for the job.
Okay,
And I'll second.
and Alice, you got that?
Yep.
Okay, any discussion? All in favor? Aye. So we can pay for these. You want to do the Inc. financial?
That'd be nice.
Or- You're just trying to get out of it.
There's a lot of that going on.
There was one transaction, and that was the check to the interport for the transportation advance,
Oh, okay.
and that was it.
I'll move to approve the financial for,
What was that, Alice?
I'll move to approve the financial for the monthly.
Okay, do I have a second?
I'll second.
We have a motion to approve the financial from Inc. All in favor? Aye. Being we're over the amount for an audit, here's another bill.
Okay.
Okay, we want to approve the budget.
I can't leave till you do it.
Oh, well, then we kind of got you.
Sorry.
Yeah, it is. So the first page is a resolution adopting the budget. The second page is a notice of the budget hearing, which is tonight. And then the last 3 pages are the worksheets showing the individual amounts.
That we've done before.
Yes.
Carol, would you like a copy? You worked on this with us?
No.
Well, so then you're gonna have to rewrite this reflecting the change in transfers?
We did already.
So that's reflected in here?
This is, yes, it is.
So this is the corrected version,
Yes.
okay? So then, I think that I'm asking for a motion to approve our budget under the ORS 440.403, Section 1, subsection A, B, C, and D as they may apply. I need a motion to approve the budget under those ORS statutes.
So moved.
He made
Yeah, I'll second.
Do you want to make the motion? I'll second.
No, you.
Sure.
Because
it's
I
your
was
turn.
waiting for you to say all that ORS 440.
No, I didn't want to.
Yeah, you leave it up to me.
You just copied Carl.
There's more to it than that.
Yeah,
Do you have anything to add on that?
yeah, adopting resolution number 2015-1.
There we go. We want to include that then.
Yeah. I
Sure.
move we adopt resolution number 2015-1 as presented. Is that right?
Yeah.
Okay.
And then, would you take one of those extra copies on the very front and sign it and pass it around? Everybody can sign it as it comes around, please.
Is
So we all
Is
sign
there-
them with
Yeah.
that?
this
is there any further discussion? If not, do I hear some noises approving this budget?
Aye.
Aye.
All right, and I. All on the same little thing here?
That'd be great.
I don't know what we would do without Pat keeping us organized with our financing. You talk about the rules that we operate under. There's a lot of rules covered in these papers.
Thank you,
Yeah. Patty.
Just on a case in point, do we have a regular audit company that audits?
Yes. Yeah, it's Bob Gale, who's with one of the CPA firms in Lakeview.
Just curious.
Okay, perfect.
That was the name we couldn't come up with when we were speaking with the attorney.
I can't tell you the name of the CPA firm, but it's Cookstool and something.
And they're in Lakeview?
Yeah.
Okay. Thank you, Patty, on that.
You're welcome.
That's all of our financial stuff. Was there any correspondence?
No, the only thing we received was, as usual, everything's nice. This internship grant program, we got it last month and I sent it to Pat, something they might be interested in, and she said that she was interested. But it's just something that we have if we decide we want to do it.
Okay, well, we'll let Earl and Alice have that then, if they want to do that. Anything else?
That was it for the month.
Okay. Old business. The security numbers for the router is still ongoing. The board talked about changing the meeting time to daytime scheduling to maybe better fit everybody. No decision has been made. Does the board still feel they want to change our meeting hour? Peg's over there changes, shaking her head, no.
Well, that's not convenient for a lot of people because they work
Yeah, I
that
know.
day.
Okay.
I am supposed to be working now, so I'm just sitting.
Okay. Well, it was brought to the board discussed it, no decision has been made, so I'm just trying to further the conversation. Does the board have any desire on what they want to do there? I'm open.
I'm pretty ambivalent. I mean, I can keep meeting the way we are. I think it was some other folks were having more issues with it in terms of trying to get out here during the day just because of the evening, but.
What fits you?
I can do either, but I can understand late night driving home alone for some people that have a ways to go. It would be a benefit.
As long as we-
That's my only problem. You know, if the roads are bad,
Yeah,
although I do have service the whole way, so that helps.
well, for the very near future, is it reasonable to keep these hours, and maybe we can get participation from
Yeah, I was gonna say, can I ask just real quickly, my assumption is you wouldn't be making every board meeting probably, because if you do, then you really should go
This
seek,
is my
you should go
first-
seek help.
This is my first board meeting, and I was told that
But
I should
what I was gonna
come.
say is that what we could do is if it's for the convenience of the board, because I know there were some people on the board that expressed the need to try to meet at a different time. We could meet at a time, but anything that would rise to this event or like would be maybe the budget meetings and stuff like that, we would make those more convenient. Anything that we would really need to have public input on,
Yeah.
where you could actually vote on it and have input, because normally in a board meeting, you're not gonna be able to vote on anything unless you're on the board.
Pretty boring.
Yeah, it kind of is. But what I'm saying is that what we could do is we could still change it so it's more convenient for us to meet at a board in the winter, but then make sure that budget meetings, anything that would take public input, that we could make sure and set those in the evening. Would that make sense? Is that a reasonable compromise?
Well, what about doing it like at a lunchtime?
Well, that's kind of actually what we talked
It'd
about.
be an hour.
That was actually
Most
what we
people
talked
get a
about.
lunch.
How do you feel about it?
It doesn't matter to me. I did have something on Tuesday. There's a park and rec meeting is on the second Tuesday, so as long as
But I
you
know
send
there's
it
been
now.
times that you've had to go from this meeting to another meeting, you know, and if it was at lunchtime, it might be more convenient for you.
That's nice. So Mondays at noon? So we were here.
I think we need to wait until we get through all our recruitment. and
Okay,
discuss
so we'll
it.
just leave it on the agenda and
May-
deal with it later?
Yeah, and the need was more for the winter.
Okay. Okay. New business. Housekeeping requesting shelving from storage building to store cleaning supplies. What are we talking about here? Hey,
I'm told that you have a shelving unit out in the old storage building out there.
Aren't there some shelves still?
yeah, well, we got space in there now, don't we, Pat?
Yeah. Well, I need some kind of shelving unit because I got my, the bulky stuff will not fit in the maintenance in the hallway. I need some kind of, to get it organized in that little closet.
In here?
Yeah. It doesn't have to be much, just 2 or 3 shelves,
Okay.
you know.
Talking like,
Yeah.
Where are you keeping those boxes of supplies now? In here?
Yeah, it's just stacked
You
on
just-
top of each other.
You need what you have in here better organized and on the
I would
shelf?
like to, yeah. I like to be kind of somewhat.
Okay.
You don't have to go out and buy one if somebody's got one. You know, it doesn't.
Well, if that's an extra one,
Well-
it's not being used, can we just move it and
I'll-
need it?
I'll get with John and we'll try to do something,
Okay.
okay?
I think I got a whole bunch of leftover IKEA stuff sitting in my garage.
Well-
I could probably find something.
Well, we won't try to use just everything left over. We'll-
Just say it.
You have to build it.
The next scheduled regular board meeting will be on the 6th of July at 7 p.m. If nobody has anything else, I'm going to adjourn the North Lake Health District meeting.
I have one thing, Doctor, I
Too late.
Well, I'm always too late.
What do you got?
I did talk to Dr. Eichner about his rent, and he was inquiring as to what other people pay, and he was supposed to get back to me by today to make his offer,
Okay.
but I haven't heard from him, so I suppose it'll be postponed to the next meeting.
Okay, well,
But he should start paying rent, he's past 3
Yes.
weeks.
okay. Okay. Do you have an agenda for ink?
I do. With nobody. Does anybody have the sign-in sheet?
It's right over here.
No, we left it out there. We gotta start another one?
If I could go ahead and, that
You guys will sign in.
sign-in sheet for this meeting? Oh, I guess she's got it.
That's what she's got.
Okay.
There's not much on this.
Okay.
Oh, I guess I better type it
Yeah, you can keep a secret.
down. I'll tell you though, mighty big secret. All right, yeah. There's nothing on it.
I'm not sure if I should get credit. I don't know if I should get credit for being.
Okay, open the meeting for the North Lake Health Center. Everybody had a chance to read the minutes?
Where would you put the minutes?
Okay, we have a motion and a second to approve the minutes. Any discussion?
I have a stupid question. Can I ask a question? What's the difference between where you were and where you're now?
That's a really good question.
I'm not confused.
Back originally, we had a nonprofit organization called the North Lake Health Center. It had a board, and we operated under the North Lake Health Center. Then in the year 2000, we went to the voters and established the North Lake Health District that also has a board. When we got the health district, we could have dropped the North Lake Health Center organization, but the board felt it was wise to retain that organization as well, because sometimes when grants are available, they're only available to nonprofit organizations, not taxing districts. The way we're operating now, we're available for grants, whether they're, no matter who they're available to, whether it's a taxing district or a health center. Probably at some point, we will drop this, but for now, we're retaining it, hoping for a grant.
Okay.
Okay. Financial report we've done. Oh, yeah. Yeah, we haven't voted on approving the minutes.
We gotta move in a second.
Yeah, we got a motion to approve in a second. Any discussion? Do I hear a motion to approve? All in favor? Aye. Okay, we got it. Okay. One thing that's in here, the shredding of the old files.
Yes, Pat, got all of the stuff she wanted shredded, put over into the old clinic. We have someone that will come out and shred, we just need to call them. It's gonna cost $500, but it's well worth it, because don't you have like 10 boxes, Pat, or something like that?
12.
12 stacked over there? And I really should go over there and look at what the district's got too that can be shredded.
Why don't you look at them and see if there's anything in there that you don't want shredded, then remove it. And then if the board so approves, after a week or 10 days, if you've had a chance to go through that, then I will call and have someone come out and do the shredding.
I have the name of the person,
Okay.
and we did approve it already, so.
Okay. Then, but I'll wait until you have a chance to go through it. You can let me know, and then I can get a hold of them and they can come out and, do that.
Yeah, because the board has quite a bit of stuff.
Would they do it at the same time?
Yeah.
Yeah.
Okay. I mean, if Pat has someone scheduled to come out, or we'll have someone scheduled, wouldn't it maybe
You're-
say?
She sent it to me.
She's shaking her head. There.
That's your business.
Okay, got it. Anyway, it's all done at the same time, whether it's the district or.
Yes.
No, we can do it all at the same time, I just have to get over there and go through what I had them take over. It's not a real lot, but it's easier than me doing it, because that much
Yeah.
Okay, already discussed the meeting time. Got anything else? With that, I'll adjourn the meeting for the North Lake Health Center, and that concludes our business for this evening.